Our first witness this morning wishes to be known as Nicola, does she?
That's right, sir.
Nicola, please.
Let's stand or sit.
Sit's fine.
Fine.
Please state your full name
Nicola Mary Leahey.
and take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth. Thank you.
Nicola, there's a copy of your witness statement on the desk, just the other side of the screen, if you need a copy at all.
Fine, thank you.
You had 4 blood transfusions, Nicola, between 1975 and 1980.
I did, yeah.
What can you tell us about that?
The first one was I had a miscarriage in 1975, and I just had 1 unit of blood then. And then in 1980, I had a hysterectomy, wasn't planned, and I had very bad internal bleeding afterwards, and I had quite a lot of blood transfusions then.
And if we look at some of your records, if we have up on screen, please, Paul, 0223007. We can see, first of all, a letter from October 1975 talking about the first occasion on which you had a transfusion, and the second paragraph explains that you made a satisfactory post-operative recovery after being given 2 pints of blood. And then if we go to 0223002, please, Paul. We can see on this and the following pages, so 03, Paul, and 04. Thanks. So we can see you've managed to obtain the what's called there the bottle numbers or the batch numbers of the particular units with which you were transfused, both in 1975 and then again on 3 occasions between August and November 1980.
Yes. I applied to go and look at my medical records, and that's when I got those.
Now, certainly in relation to the transfusions that you received in 1980, those were given in what were otherwise life-threatening conditions.
Very much so, yes.
Was the same true in relation to 1975?
No, and I quite honestly don't know why I had them then, but I just had a spontaneous... I'd seen the baby that morning on a scan, and then just at midnight I suddenly was losing the baby, and that was it. But I was actually discharged home the following day, so I don't know why I had them.
Was there any discussion with you or with your husband in 1975 about any risks of infection associated with the transfusion?
No, not at all, no.
In 1980, when you had the 3 transfusions, your medical condition was such that you may not have been in a position to have such a discussion.
Yeah.
But your husband was there, and indeed your statement says he was asked effectively to agree on your behalf to some of the transfusions. As far as you know, was there any discussion with your husband about any risks of infection?
No, not at all. It was all done so very quickly. I mean, it really was emergency.
If we come forward from 1980 to 2006, you took early retirement at the age of 55.
Yes.
What job had you been doing at that stage?
I was clinical governance and audit manager, and a high-profile job, well paid, and there was a lot going on within the trust, and I would realise I wasn't actually working to my full potential. I was lack of concentration. I was very much a go and do person, and I was letting things. I'm very methodical, very. Give me a spreadsheet and I'm made, you know. But I was letting things get on top of me more, and I thought, well, no, I'm not giving it all. And I'd always said that the day I didn't believe in myself, for one reason or another, and I couldn't give everything, I was so tired. I mean, I was a workaholic. I mean, I put a lot into it, but I was coming home absolutely and going to bed. And I just said to my husband, right, I'd reached 55. You can finish at 55. They tried to say, well, don't. And I said, well, no, I've got to do. And that's how it started, really.
And when you say your work was clinical governance and audit management for a trust, that was within the NHS. You
Yes.
worked at a senior management level within the NHS.
Yes.
It hadn't been your intention to retire early.
Not at all, because where I was working, the structure of going up, I could have gone up, and I really do believe, and without wanting to sort of blow my own trumpet, I would have been a lot higher. I'd have been sort of a director. I mean, even now, I think that's what would have happened.
And the symptoms that you were experiencing, not knowing at that stage what they were due to, were tiredness related. You described them as extreme tiredness in your statement.
Yeah.
And concentration difficulties.
It was the concentration. It was not being able to see something through, or having the reasoning to be able to actually, to see something through. I couldn't see the end product the same as I would used to be able to do. And I was disappointed in myself. So I thought, well, this isn't right.
And looking back, do you have any idea as to how long you'd been experiencing those symptoms prior to your retirement in 2006?
When I was looking back, it had happened over quite a few years, and I was sort of doubting myself. And it was just, I mean, we have a laugh in the family because I'm so tired. I mean, just as an example, we went to America and I literally fell asleep into my dinner because I could just switch off. And I would just go, and when people talk about being tired, yes, you're tired. When I had 3 young children, very young, and you're tired then, but good God, I mean, I was shattered, so that's the difference.
And you took an ordinary early retirement, because not a medical retirement,
Yeah.
because you didn't know that there was anything medically wrong with you at that stage.
No, not then, no.
How and when did you find out that your symptoms were attributable to hepatitis C?
Right, in 2009, it was bizarre because my mum had died, and I'd got worse. I'd got a lot of bruising. I mean, I've got one now, but I just bleed very easily, and the bruising was more. I put it down to at first the grandchildren climbing over me or whatever, but the tiredness had got worse. And so I thought, well, right, I'm going to the doctors. And I went, and she said, well, I don't know why, let's do some blood tests. The first lot of blood tests didn't show anything. And then I had a second lot, and she was just doing the ordinary blood tests. And then I was talking to somebody that worked in the pathology department. And looking back now with hindsight, she knew. And she just said, tell them to test your LFTs. Tell them to test if you're Hep C. And I said, right, fine. So I went back to the GP, lovely woman, and told her, she said, right, fine, that's what we'll do then. And that's when it started.
You were then sent for a liver ultrasound in the July of 2009 and some further blood tests.
Yeah.
And it was your GP who, in August 2009, asked you to come into the surgery so she could talk to you.
Yeah.
And what was she able to say to you?
She just said, I'd suspected, I'd looked it up, and especially with this person telling me about going for Hep C, and she just came straight out with it. She just said, you've got hepatitis C. I said, well, how?
Was your GP able to give you any information about the condition?
No, and lovely woman, brilliant GP in that much. I think I was the first person she'd ever known with that. And I said, well, I've done a bit of research. And she said, well, I definitely will now. And that was it. I asked her what the next stage would be. And she said, well, you'll be sent to the hospital. It might take a few months. And I said, well, I'm not waiting a few months. I'm fortunate with being in the NHS, and it was the same trust as who I knew. I then rang up and got myself a private appointment and was seen the following week or so.
And you've described in your statement how you got printouts about hepatitis C and about NICE guidance in relation to treatments for hepatitis C from the internet.
Yeah. And it's ironic again, I was actually the Northwest Regional NICE person. I mean, nice as in nice, not nice.
National
Might have been nice as well, but so, I mean, I knew where to look, I knew where to do the research, and that's when it dawned on me that I was one of the statistics of having that.
You saw a consultant privately in August 2009, and you said you arranged that because you didn't want to have to wait a number of months in order to see.
They told me 3 or 4 months, so I paid and went for it.
And how much information did that consultant provide you with?
Not a lot, and not very supportive, and it was difficult because I knew him professionally, and he just sort of wanted, right, fine, he said, well, I'll put you onto the NHS system now, you'll be seen, you'll have an ultrasound. He told me what would happen, and he said, and then we'll find out what genotype you are, and then we'll go from there. But no, nothing really to to support me really, or to feel that I was in safe hands.
And so you saw that consultant again the following month in September, and you had a list of questions prepared.
I did.
And did you feel that your questions were being answered?
No. Unfortunately, because he probably knew me, and I'm a person that speaks out, and I used to do a lot of lecturing to doctors and nurses, and he'd actually been in quite a few of my lectures, and I don't know if he was frightened of me more than I was frightened, but wary of him. But no, he didn't really have much.
And you said in your statement you felt he was very dismissive and effectively just passed you over to the nurse, the specialist hepatitis nurse.
I was concerned because he sort of straight away he'd said to me, because I said about how I think I got it, and he said, you've not been promiscuous, have you? And have you had any other sexual partners apart from your husband? And I felt so high, and that's when I felt insulted. But no, he just, how much I paid was a hell of a lot for that few minutes I was in there, and he wanted to get rid of me. So that was it.
And you also referred to whether on that occasion or another occasion, asking whether you'd had needle stick injuries, tattoos and piercings, as well as sex with other partners.
Yeah.
Which you found insulting and embarrassing.
I do, yeah, very much so.
You then had a liver biopsy in October 2009. Again, that was undertaken by somebody who you'd known when you worked at the trust.
Yeah.
Was that, did that make it more comfortable or uncomfortable?
Embarrassing. I mean, I know it's only in your side and everything. I think they were embarrassed as well. And having the whole procedure, I mean, the consultant radiologist did that and talked to me, and we chatted about other things, probably about audit, and the nurse was chatting to me. But it was just a general, and I don't know if anybody knows, but when you have a liver biopsy, you have to lie flat afterwards, and so you're in overnight. And to be having to lie flat and not have the understanding of the staff that why you were having to lie flat, because you could easily bleed to death. And there's nothing more annoying. I mean, I really work for patients and patients' experience. And to be lying in a bed and then come along, and then at the end of the bed is your finger, the table. And then somebody comes along, I said, well, I'd really like a drink of water or something. And they put it at the end, and you can't because you're lying flat, and so you can't reach. So I said to the nurse, I said, can you just bring it here for me, So she brought it. And then I said, well, can I have a straw? I said, because otherwise, how's it going to get into my mouth? Oh, she said, I hadn't thought of that. And it's just that I felt like I had to be in control, because that was the only way I was going to get anywhere. And also it helped my self-esteem that I wasn't the vulnerable patient. I was actually somebody with a voice, and I had to explain to all of them, because I don't think anybody had been up to that particular ward after a liver biopsy before, and I had to explain to them all the process. I actually started an audit after that with them. I got onto them and said, why don't you just audit people and see what nurses know about the conditions that people are coming up for.
Are you, after the biopsy, you saw the same consultant. You were told your genotype, which was genotype 3A.
Yeah.
And again, you said in your statement that you didn't get a lot of information or any clear sense of the severity or potential severity of the condition.
No, I didn't realise. I mean, yes, I've done my research and everything, but I didn't actually realise it was so bad as it was. You know, I thought, yes, it's my liver. I'm very fortunate because I've always been very fit, and that's what they told me. It was, I'd not drunk a lot or anything. And so they said, well, you know, you're in a good position. But I hadn't realised how it really was.
And you've described that consultant as telling you were very lucky.
Yes. Really annoys me that. To keep saying to people that you're lucky, he told me, I can still see him, you're so lucky you didn't get HIV. You know, there's no luck in it, you know. I can sort of, you know, it just annoys me that people do have that attitude.
You were then told about the treatment that you were going to start in January 2010.
Yeah.
Which was pegylated interferon and ribavirin.
Yeah, yeah. And
you started that in January 2010.
Yeah.
What was that treatment like?
Bloody awful. It was hell. I mean, I wanted to start before the Christmas. And the specialist nurse said to me, no, she said, give yourself Christmas, which wasn't a good Christmas because I knew what was going to happen. I'd told the family, obviously. So we started, and it was the first week in January. I wanted to really get it in. Started on a Thursday. And then she taught me how to inject myself for the first couple of Thursdays. And then after that, I did that every Thursday. And I did that at 4 o'clock on the Thursday, because you have to do it at the same time. And by 8 o'clock at night, I was finished. The headaches, the sickness, just like having, well, it's not just like having flu, it's like having flu times 100. It was hell. No, I couldn't be in lights or anything, so I was just, I became a bit of a recluse, really, upstairs. And then by Monday, I was coming round a bit. And then, of course, it's Thursday again then. So.
And you've said that in terms of the discussions you had with the specialist nurse about the treatment, that she talked to you like you were a child and didn't seem very compassionate or supportive. What can you tell us about that? Again,
it's difficult because she knew who I was. And I think it was perhaps it was her way of giving power, or she wanted that power, and so she was in charge, very much in charge. And as far as I'm concerned, a patient should always be in charge of their own body. It's, you know, you're the expert with your body, you know what is it. They're the experts in caring for that body, or supposedly, but you know yourself and your feelings. But straight away from first meeting her, she had that, I don't know, she didn't need to be like that, but she wasn't at all approachable. We went together and she spoke to us both as if we were idiots, really, didn't she?
Children.
Yeah, just like little children.
And you were told you were lucky to be getting the treatment and it was very expensive.
Very, yeah, she was very lucky. And so I'd said, because she explained to us the process, she said that if it hadn't worked or had any showings of working at 12 weeks, she would then discontinue. And I said, why? You know, and she said, well, it hasn't shown any signs, then that's what we'd have to do. I said, oh, when would I then start my next lot of trial? Well, she said, you won't be having another lot. And I said, why? And she said, because it's far too expensive. We can't afford that. And I said, oh, I will be. If I have to pay for it myself, I'll be having another go at it. As it was, it didn't occur. I mean, it had cleared. It was showing clearance at the 12 weeks. But no, not at all helpful in that respect.
Well, you've described some of the side effects from the treatment: headaches, flu-like symptoms, tiredness, light sensitivity.
Joint pains, yeah.
You also lost hair.
Yes, I lost a lot of hair. Luckily, I have got thick hair. That's come back. Not as thick, but perhaps that's a good thing. I lost all my body hair, and that sort of my eyelashes, which I found a new product. If anybody's lost their eyelashes, I've found a new product that's grown my eyelashes again. It costs £75, but it's worth it. But it's the self-esteem, isn't it? You know, I mean, you can do without shaving your legs, etc. It's brilliant, you know. But you lose yourself. I wasn't Nicola anymore. The same, you know.
And you said your moods were affected. You became depressed. You became irritable.
Oh, you can ask Terry, yeah.
Unbearable.
You had itchy skin.
Yeah.
Cough.
Yeah, they gave me creams for my skin. And obviously, with it being January, and then obviously it went on till the end of July. So I missed all the sun that time. And even afterwards, because even when you're finished, you can't go in the sun. Well, I couldn't. The skin was terribly itchy, and the scalp, because obviously the hair was coming out. But and the cough. Now, the cough they sent me, because they were quite worried about that. So they sent me then for tests for that. And also I had, I forgot what it's called, my heart rate fluctuating a bit. So they sent me for tests on that. But it was just constant, that cough, wasn't it? You know, so that lasted. I mean, I know that they say that it can be in your body for 12 months afterwards, and it certainly was, you know.
And you became very depressed.
Very
in the course of the
depressed,
treatment. You said that even at one point you felt suicidal.
Yeah, because you feel, I mean, I feel guilty of saying that, but at the time, I wasn't Nicola. I was this pathetic thing that was constantly tired, more in bed, feeling ill. And I thought, what the hell am I here for then? Am I a burden? And that's what I felt. I thought, well, if this is what life's going to be, I am a burden. I couldn't see my grandchildren the same. You know, they were just got used to grandma was up in bed. And I had a brand new grandson at the time. And I used to have some of the children. And I lost my usefulness. And one of my sons and his wife and the children, they moved away because I couldn't actually be of use to them anymore. I mean, there might have been other reasons, but I think that was the reason. And that's why I felt, what is my role? I was always the matriarch of the family. I was always the person everybody came to. I was always the strong person. I'm a very positive person. And then suddenly I was thinking, why? Why go on if this is what it's going to be? So, and I might have relieved Terry of a lot of misery.
You did clear the virus as a result of that treatment, but the physical symptoms haven't gone away. What symptoms have you continued to experience?
Very much tiredness. Very much, I mean, digestion trouble, IBS, etc., terrible. I can't drink. I have very, very bad sweats. I mean, at night, and it's like going through the change again, really. And I went through that early with having an early hysterectomy. But sweating terribly. I can't eat spicy foods, garlic or anything. I mean, I'm just a bland person now. And not being able to drink, even on special occasions, is a shame. I'll, just have water. But it's the cramps. I get terrible cramp, which they say is putting down to that. And the GP's brilliant. And just a little thing I've just shared with somebody now that she said, well, I might have to put you on quinine tablets. Well, you can't take quinine if you've got liver problems. And so she said, oh, yes, And so it's things like that. But it's the constant tiredness. It's the stomach upsets. It's everything really like that.
And you have sleep problems now?
Terrible, yeah. I take tablets for that, for the anxiety as well, because it's that overhanging all the time of what if.
And in terms of the ongoing psychological, cognitive consequences, you continue to suffer problems with memory and lack of concentration.
Yes, I do. I mean, and that's what's so annoying and frustrating. I'm fine if I'm writing something because I can take my time. I can ask Terry what word am I trying, and the simple words. And I just said, I mean, I'm used to lecturing and doing all that, standing up in front of people, and I don't. I end up saying thingy. When, you don't, when you're talking to a group of people, you don't say thingy, because they don't know what you mean, and and I've lost it then, and I can't remember what people have asked me, and it's that concentration's gone worse, and it's just it happens to me regularly. Terry gets really cross with me, but it's the fogginess. My mind isn't me. I know I keep saying it, but I'm not Nicola anymore. I'm not the intelligent person that I was, or I don't display it anyway.
And you've also experienced anxiety and guilt. And I wanted to ask you about each of those. In terms of the anxiety, you worry a lot about the condition coming back?
Yeah, I do. I worry that, yes, I have the blood tests, and so I might have a blood test tomorrow. I might get the results in the next couple of weeks, and it might say, fine, it's still okay. But what happened, in between that, it might have come back then. So it's a whole cycle of every 6 months. You're going through it of what if, and I prepare myself for the worst. And I went to see a consultant, and he just said to me, well, it tends not to come back. And so I jumped up at him straight away and said, you've just said the word. I said tends. He didn't like it, but that is the attitude of it tends not to. Nobody can say 100% in anything, and it is just that overhanging all the time. So that's what causes me the anxiety. I wake up in the night thinking, is it there? Especially if I'm sweating a lot, or if I've had a particularly bad day, and I thought, well, is this the start of it again? So it's just there.
And you've felt sensations of guilt. You have worried and continue to worry that you might have infected others, not just potentially your family or friends, but you ran a play group for a number of years.
I did. I had, when I was having the children, I didn't work, and I started off as a mums and toddlers, and then it came into a full-blown 3 to 5 year olds as well. And very active. I just love kids of that age. They're like sponges. I mean, it's fantastic. But what if? I mean, that was after 1980. What if I'd actually had a cut and passed it on to them? And I feel, at first, when I first found out, I felt like sort of writing to them. I don't know who they are or where they are, and saying, look, go and get tested because I might have passed something on to you. And it is that, yes, you said about the family, yeah, they were all tested, but it's just that guilt of what if. It's that overhanging of what I had quite a few lesions and things off, which I don't know why, there weren't moles, and I had a real big one dug out of my arm, and it spurted up into his face, and this was before I was diagnosed, long before, and we had a joke about it because he was covered in blood, and I said, well, you should have been wearing a mask, and so what if he'd got it? What if I've passed it on to him? And I mean, I don't know his name or anything, I can't remember, but that's awful, so I have a big thing about when I go and have my blood tests, about them having to put gloves on. And I feel awful about it, really, but I always say when I go in, I like to make sort of light-heartedness because I feel awful. And so I go in and say, oh, I've come for this, and I had it because of a blood transfusion. And I shouldn't have to justify why I got it. And so then I always say, you are going to put gloves on, aren't you? And some didn't. And in this particular chap, only about a year ago, and he said, oh, I don't need to do. I said, you do? Oh, I'll be all right. I said, you might think you're all right. I said, but for my sake, I want to feel confident that I've not given you anything. So, I mean, it's up to you for yours, but for my sake, that's important to me. I said, please put the gloves on. And I actually reported him afterwards, and I didn't see him again.
You've got a number of other health issues that you suspect may be connected with your hepatitis C or with the treatment and liver damage. You have osteopenia.
Osteopenia, which is just before you get osteoporosis. And I've just had another scan, and it's gone. I'm really on the border now. And they said that's probably, you know, as a result of either the treatment or, the hep C.
And you've had problems with your eyes?
Yes, yeah. And that was something that I'd only happened to just mention to the opticians. And she said to me, she said, oh, she said, it deteriorated terribly in the last 12 months. And this was a few years ago. And I explained, she said, have you had any health problems? So I explained to her, she said, oh, that could be related to that. I said, oh, right, fine. And they're deteriorating quite fast, actually.
And in terms of your worry about the risk of developing cirrhosis or liver cancer, have you ever been offered any support or counselling to help you with that?
No, none whatsoever.
You had a recent FibroScan in December of last year.
Yeah.
And you had to specifically ask for that. What can you tell us?
Yeah, it was when I'd gone to one of the support or the groups, and it was the first time I'd met anybody else with hep C. And I went, it was July 24th last year, and went to Liverpool and got chatting. And I thought, oh, heck, there's other people out there, and they're having regular checkups. And I don't, I only have my blood. So I thought, this is a bit weird. So I went back to the GP, and she said, oh, right, fine. I said, I've heard about, well, I'd read, I said about FibroScans. I said, not everybody who's been recently diagnosed, they don't have to have a liver biopsy, And she said, oh, no, the FibroScan. I said, I'll refer you. So I was referred to the hospital to have a FibroScan. And very disappointed, I went in, and he said, what are you here for? I said, well, FibroScan. I said, I've not seen anybody, and this was December just gone, so sort of 6 months ago. I said, I've not seen anybody since 2010. I said, I have regular blood tests. And I said, but he said, well, you're all right. He said, it shows up on here that you're okay. It tends not to come back. And I said, well, I'd like a FibroScan. I'd like to have that reassurance, please. Told him about my anxiety. And he eventually, and it took a bit of persuading, he went and got the machine, lay me down and did the FibroScan. I wasn't chaperoned, which I should have been. And he did it. He said, oh, yes, he said, it's within the limits, considering you've got fibrosis of the liver, etc. It has gone up a bit, but within the limits. He said, that's all right. He said, you won't need to have any more blood tests. I said, why not? He said, because you'll only have to come back to the hospital or anything like that if you get cirrhosis or liver cancer. So I very quickly said to him, I said, well, how will you know that? If you don't do the blood tests, how will you know, I said, all the FibroScans, how will you know whether I've getting cirrhosis or liver cancer? Well, of course, that stumped him. I'd already annoyed him with tackling him about saying tend, and so that really got his back up. And he said, so are you happy now? I said, well, I'm very happy, thank you ever so much for giving me a FibroScan. I said, I really appreciate that. And I'd stood up by this time because he'd stood up, and I thought, well, we're playing the big and little game, So I stood up, and so he said, are you happy? And I said, oh, yes, thank you ever so much, very grateful. Went to shake his hand, and I said, but I'm not happy the way that you've said about not having to have any more blood tests. And he said, right, here you are, and showed me the door, and that was it. He sent me a copy of the letter, as you do, that was going to the GP. I went to see the GP, and she said straight away, she said, I know what you're going to say, Nicola. She said, don't worry. She said, I'll keep on giving you the blood test. I said, thank you. I actually have put a comments about the particular doctor, and he hadn't even apologised to me. But I wanted to get over I, as a strong person, I'm a positive person, he turned me into that vulnerable patient. I was sort of saying, yes, sir, no, sir, but luckily I found my voice in time. I mean, I should have said something about lying me down, stripping me off, and not having anybody in the room with me. I should have said that. But I'd turned into this person again. But it's attitude, no support. He told me he'd written some papers on it when he was a junior doctor. So surely, if he'd written papers on it, he should have had a bit more understanding about Hep C and the side effects, etc. His lasting remark to me was when he was asking me if I was happy. He said, well, you've had your money, haven't you? And I was stunned, you know, as if to say, well, you're all right because you've had your money from Skipton and be on your way. And I was furious, wasn't I?
You was.
I mean, Terry was annoyed with himself that he hadn't come in the room with me.
Because he'd got 2 people with him before,
Yeah,
2 girls.
But they'd left then, and we just walked out stunned.
And one of the points you wanted to get across is even you, as someone who had been a senior manager in the NHS, who had lectured to doctors, including consultants and nurses, who had audited their work, you felt yourself becoming powerless in the course of that consultation.
Yeah, and I do a lot of work now with patients and patient experience, and it's amazing how easily you can fall into that trap of being the vulnerable patient. And he was, it's as if he was in his element, that he'd reduced me to that, you know. But luckily, I gained my thoughts again, and as I said, I stood up.
And in terms of the ongoing work you do, you're a governor of an NHS Foundation Trust, which is a voluntary, not salaried position.
Yeah.
And the work you do there and have done there for a number of years very much focuses on trying to improve the patient experience. Yeah,
I'm lead governor, and I'm also chair of the patient experience group, and I'm on a lot of different committees about patient experience, and I just want to keep on with the voice of being the voice. I mean, that's what governors are there for, to represent the public and patients. But again, it's just being able to listen to the patients. We do a lot of CQ style going around the hospital, talking to patients in beds or in outpatients. And a patient will often talk to a person in ordinary clothes and they say to us, it's the nurses, everybody are too busy to talk to you. But they'll tell you something that's important to them. And I think it's little things like that. If I feel that I can be there for a patient and get that message back to the staff, and without wanting to bore everybody, but an example is, and this is what I use, is I was talking to sort of a patient and he said, everything's fine, food's lovely and all the rest. He said, but what's really annoying me is that the bloody door banging all night long, you know, next, and it was a sort of the sluice door outside. I said, right, fine. So I went to the reception desk and I just said, have you got any blue tack? And, oh, no, we're not allowed to use blue tack on the walls, you know. And I thought, yeah, I think she thought I was testing her, you know. And so I said, no, I said, just give me a little bit. And I went to put it on the door and it stopped banging. And they said, oh, thank goodness for that. Someone's done something. So obviously, you know, we reported it and it was mended. But it's having that contact with the patient to help them have that voice. And that's something I truly believe in, you know. So, but no, I do it as volunteer. You can only do 9 years as a governor. So I'm out after this. They've asked me actually to become a non-exec director. But again, I'm not doing, because that's salaried. And I can't commit myself, because I'm shattered. I can do a day at the hospital and that would drain me. So I couldn't I couldn't commit myself to that. But I still want to do some sort of voluntary work, just to be there for people.
In terms of the impact on your family and social life, you said in your statement that your illness and symptoms and then the treatment and the ongoing symptoms you've been left with had a significant impact on your family life. you weren't able to continue caring for your grandchildren.
No, that was the hardest thing, because I did have, the young ones sometimes, and as I said, like, they did move away with that. The other one, she was a couple of years old. I'm just trying to think now. Yeah, she was 4 or 5 when I was diagnosed, and I was very, very close to her. Virtually brought her up, at that time, and I couldn't carry on with that. Terry went part-time working, so that he could, marvellous at hoovering up and cleaning, and looking after the children. But no, I missed out an awful lot on that. So.
And what's the impact been on your relationship with Terry?
Well, he's still sitting next to me, We might not talk, but no. I can joke about it. It has been hard. And I think we went through a lot. When I was very ill, it was horrible, and he went through a lot then. I was all right because I was on morphine. I was bouncing through the doors, He brought up 3 young children under 5. But
under school age.
Yeah, so we've come through that, and we've come through this, but I am irritable. I am a perfectionist, and I'm not the only one that's suffered. Put it that way, and the family as well. They've seen a change in me. I'm more irritable with them. I'm more, well, why this, and there has been a change.
And your children, you said in your statement, started treating you as an old lady rather than as the go-to person who would sort everything out.
Yeah, I'm not that anymore. I'm Nicola, sort of, I'm mum, just mum. I didn't used to be just mum. I used to be, as I said before, the matriarch of the family. I used to be in control. I used to be the person. And, I used to be called, funny enough, the boss, because I am a bossy person, you probably can tell. But, I'm not that anymore. And I know that they're old. They're in the 40s. So that they take control of me now, which I'm not ready to be in the Zimmer frame and be led around like an old woman, but that's the way I feel that I'm being treated now.
I wanted to ask you about accessing your medical records.
Right, yeah.
You've described in your witness statement the process of trying to get hold of your medical records. What can you tell us about that?
Tried to get hold of them, couldn't do. They weren't available. And then by other means, I got hold and looked at them. They sat with me all the time whilst I was looking at them.
And just pausing on, this was in relation to the treatment you'd had back when you'd had the blood transfusions and the surgery.
Oh, yeah.
It was after that you wanted to find your records.
Oh, yeah, sorry, that one. Yes, when in 1980 afterwards, because I was so ill, it was very apparent that something had gone wrong with the surgery.
And you were told those records were missing?
Gone, yeah, they'd gone.
And then it was later you tracked down your records and were able to look at them, but you didn't take copies of them?
Yeah, no, I tracked them down when I was working, and I didn't take copies. I read them, and when I actually got them after I'd been diagnosed with Hep C, I then went back, and as I said, they weren't found at first, and then they were found, but they weren't the complete records I'd read in the 80s.
And you've said there were records of your transfusions, and we've seen those in the documents you've produced, but other things you'd seen when you'd looked at the records previously were missing, such as comments from doctors and notes and the like.
They'd put in at the side, when they'd written afterwards, when it was apparent that what had happened in the surgery, I had a cardiac arrest and they'd found a pulmonary embolism. They said I got a pulmonary embolism, so they'd given me heparin. And he actually admitted to us afterwards that it was so vascular, he'd missed sewing me up properly. I didn't have an abdominal hysterectomy, I had a vaginal one. And that, again, I was one of the first people to have that. I think I was just a guinea pig for that. And he said, oh, yeah, he said, I missed something. And so I didn't sew you up properly inside. And I blew up and very badly internal bleeding. And it was then that I'd seen in the notes and I was reading about this, and must watch this one, must be careful, must look after her. You know, they were virtually admitting on paper that they'd made a big mistake. I mean, we know that they'd made a big mistake, the fact that the way they looked after me, and I was in hospital for 4-5 months, and they put me into another hospital out the way a bit because it had affected my kidneys and things. And they actually got my youngest daughter, who was only 4, she was 3 and then turned 4 whilst I was in hospital. They got her into school for a year earlier for me, and then they got me a home help. And I had the home help for over a year because I couldn't look after. The youngest one was only 15 months old when I went in, so the home help came and looked after her, and because Terry had to go... looked after him because Terry had to go back to work and everything. He had 6 months off.
And you don't know what's happened to those missing records?
No.
Nicola, those are the questions I have for you. Is there anything else you would like to say?
Yes, please. I'm going to read it, if that's all right. Right. First of all, I'd like to say thank you for allowing me to be here and to listening. Now, strange as it may seem, I want to thank and acknowledge that probably without the blood transfusions I received, I would possibly not have seen my children grow up. I would not have seen my grandchildren. I would not have had 47 years of married life, deep breath, with the love and support of Terry and my family. But I could have died earlier with Hep C. And I'm so thankful that I've been a lot more fortunate than some people who have been infected. Now, that was the positive. Now, in 1989, the government published a white paper, Working for Patients. That's when I became involved. I took a reduction in pay to be one of the first 23 in the country to form medical audit across the trusts. It's now clinical audit, and there are now thousands of staff, and clinical governance was born. We looked at complications and deaths. NC-POD, the confidential inquiry into patient outcome and death, evolved. Not just collecting data and statistics and counting numbers, but delved deeper into whether the deaths and complications could have been avoided. This was something so close to my heart, and I felt strongly that following my surgical complications that nearly led to my death, I wanted to help identify and spread the word of the importance of lessons learned. Little did I realise that some 14 or 9 years previously, I had in fact been infected and could have been one of those statistics. We audited case notes following the Shipman case in 1998. One outcome was that it changed the way that morphine was stored and administered. Other high-profile cases in the NHS triggered audits. Therefore, my question is, when they realised about the contaminated blood in the 1980s or wherever, why were audits not carried out, or were they? Why weren't all patients who had received blood transfusions tracked and tested? Why weren't lessons learned? In this inquiry, is this inquiry going to be able to say, however too late, that lessons have been learned, and more importantly, action has taken place? On a personal note, why was my Hep C not detected earlier? I had had several hospital admissions and surgery, or had it. Why was I made to feel like a leper? Why did I go from being the matriarch of the family to go to the person to suddenly become a useless, ill, depressed person with seemingly, in my eyes, nothing to offer? I had lost my purpose in life. Why did I deteriorate mentally, loss of concentration, confidence? Yes, I can talk confidently as I used to. I used to lecture to nurses and doctors and other healthcare professionals. I forget words and often say thingy instead of the correct word. I'm okay writing, as I can take my time and use a dictionary or thesaurus. My wish at the end of this inquiry is that there are actions as a result of lessons learned, that all people who have had blood transfusions be tested, a simple quick test that would probably save lives, that NHS professionals act quickly with empathy and support when dealing with the infected and the affected. Thank you. Okay.
Thank you, Nicola.
Oh, I do have one or two questions, really about the patient experience that you have specialised in for the last so long. Can you tell me whether you think the patient experience generally has improved or not over the period?
In a word, no.
And why not?
I think to defend the NHS staff, I think the shortage of staff perhaps has some bearing on it. People are more busy, they haven't got the time. But to also say, it's double-ended in a way, that their lack of understanding hasn't matured in the way that it should have done. They're all busy getting on with what they're there for. One of the biggest things I also talk about is this business of talking about a patient at the end of the patient's bed, not with the patient. And I've also developed patient diaries now, which involve, we give it to the patients and they put in anything that they think of, because there's nothing worse than when you see a consultant and then you think, I wish I'd asked that. And so if you write it down as a patient, and then when they come to the end of the bed, you actually, and it shouldn't be the patient's job to actually involve the staff, it should be the other way around. But you actually say, look, you know, you told me this yesterday, I want to talk about it now, please. And so you engage in a conversation. There are doctors, there are nurses, are fantastic, and they do that. But as a whole, I think it's lacking in the understanding of the importance of the patient voice.
And have any of the patients whose experiences you've captured suffered from hepatitis?
Not that
Apart
I
from
know
yourself?
of. Not that I know of.
So how would you say your experience, which you've told us about, the way you were treated at the end of last year, how do you say that would compare with the broad generality of the patients whose experiences you've captured?
I think I hear a lot of comments from them saying that the doctors haven't had time to explain anything to them, or haven't. See, again, I'm being, what's the word? Nice to the doctors by saying that it's the lack of understanding, perhaps, that or the need or the training that they need to explain what support is there, or have the empathy to say and have the time to actually say and talk with the patient. And I think that's what's lacking sometimes.
So training, time, understanding, approach.
Yeah.
What perhaps used to be called bedside manner.
Exactly. Yeah.
What would you do about it to put it right?
Go and talk to more people, have that experience, show them experience, talk with them. I always said when I used to do the lecturing that every doctor and nurse or anybody should be in a hospital bed for a day and a night especially, because it's awful at night time. And if you're lying in bed with all the lights shining still on you and you want to get to sleep, and what's even worse is when you get to sleep, they wake you up half an hour later and say, here's your sleeping tablet, you know. And that's really annoying, you know. But I always said that every healthcare professional should be in a bed, have every tube possible poked up any hole in you, to realise how you lose your dignity, and to realise that. And I think that is so important. I mean, I wouldn't wish it on anybody, but then you put yourself in the place of the patient, and that is so important. I mean, I have a big thing about confidentiality, and I go and sit in the outpatients departments, for example, and witness, and I go along and I sit just on the public, and then I pick one consultant up, I sound awful, don't I? I sound like I'm just going at them all the time. But I just had to remind people sometimes. A patient had come out of his room, and then he started dictating the letter, and everybody waiting with me, you know, around could hear. So I got up, being Nicola, and went and closed the door. And so when he'd finished, he obviously came out, you know, to see, you know. And so I said, it was me. I said, because we could all hear. I said, so that's patient confidentiality. And, oh, yeah. I shouldn't have had to have done that. And what happens if I hadn't been? I'd have known that Joe Bloggs lived at such and such an address and had such and such thing wrong with him. That's wrong. And so it's just that constant awareness of what's going on. Everyone's perhaps tunnel visioned of what they're doing, but you know, they shouldn't be. They should be looking at the wider picture, thinking outside the box.
Thank you very much. Ms. Richards, do you have any questions which arise out of that, or for that matter, nobody else has passed you one?
No, sir.
Can I thank you very much indeed for that, for the whole of your evidence and your story, and coming here with Terry.
Yeah, thank you.
To tell us.
Thank you.
Thank you.
Thank you.
Well, we'll take a break now until 12 o'clock.
Yes, sir.
And at 12 o'clock, I think our next witness is to be known as Miss N.
That's right, sir.
That's N for November, just in case anyone misunderstands the pronunciation.